it in the Facebook, and others started complaining and added, and then the CID got on to that, and that's how the arrest came up. In the Facebook, and somebody complained, now we have inflated prices, it could be bought somewhere else cheaper, found out. Got on to, and then about 70 cases have been, they collected evidence of about 70 people before the arrest took place.
I know.
Now, Ranjit.
She's a graduate of Monash University.
Yeah.
She's from the NCMC, I think. And then when he took over, I think she must have moved, and she is a MBBS from Monash.
Where did she do the training?
Pardon?
Where did she do the training?
That I don't know. But she's a fully qualified neurosurgeon.
Now, if she's in Sri Jayawardenepura Hospital, that means she's a pretty senior lady, right?
Oh, yeah, senior. She's in a...
She must have done the local exam, no? Otherwise, they won't take her as a consultant there.
No, she would have done a fellowship as well. She had a fellowship that much.
No, she had a fellowship plus a local MS.
Where did Milroy get his shunt done?
Pardon?
Where did Milroy get his shunt done? Not Milroy, Ranjit.
Ranjit, where is your shunt? How much did your shunt cost, Ranjit?
Huh?
How much did you pay for your shunt?
How much is pay for the shunt?
Yeah, how much did you pay for it?
Shunt.
Yeah.
4,75,000.
How much?
4 lakhs.
475,000.
400, that is the total bill, is it?
Total surgery, total bill.
I'm talking of the shunt itself.
Pardon?
The shunt itself.
Yeah,
How much did you...
The device.
475,000.
That's unusual.
Oh, that's for the whole shunt. Whole surgery, Majan.
No, surgery, the surgeon's in charge, so I didn't have to pay.
How much?
Surgeon in charge.
Paid in charge, surgeon.
Yeah, so 475,000 is what you paid to the hospital.
Yeah, because...
So that includes so many things. I mean, theater, ward, all that. That's different. Yeah, that's okay. I'm talking about the shunt itself, the cost, you have no idea.
So, Mayan, what hospital did you go to?
To Pasiri Central.
That's completely private. No, this is autonomous. Semi-autonomic.
It is it is totally private, and that's one of the hospitals that Ranjit used to work in. I also did work there for about 4 or 5 years after I retired.
Well, when you go to a private hospital like that in Sri Lanka, do they do a credentialing and do they look at your credentials and your education and all that? Do you have a committee to decide who can work there?
Reference?
No. I mean, if you have been registered, if you have a Sri Lankan graduate and you have postgraduate qualifications which you can show the certificates, you can practice. There is no issue at all. I had no issue. That's all I had to produce. The fact that my fellowship certificate.
Your specialty certificates?
Yeah, that's the one. The fellowship I also had a certificate from this. There's a thing called higher specialist training in UK. I had that certificate, and that's all I produced. And then they said, okay, you can start working. You can start seeing patients. I didn't do any anesthesia. I did only pain management. I did various nerve blocks and that kind of stuff. I didn't do any anesthesia.
From where do the patients come? How did you get your patients? You advertise?
Sorry?
Do you advertise? How did you get your patients?
I didn't. I just
Happening down there.
I think word of mouth, basically, because there is a list
Why is
on the board. They give the names of patients, the various specialties and the names of the doctors. And under pain management, it was just my name at that time. So the patient look at
an international meeting.
Word of mouth, basically. There was no other. And then I started getting...
It's Saturday. But this Saturday, suddenly it came up. So I brought my computer. And
but corruption, see, the point is, There has been a change of ethos. When we were growing up, medicine was more or less a service industry.
No, I'll finish
Of
this.
course, there were some private groups.
I'll finish
And when the specialists, remember when you were in medical school,
over the world.
the specialists in Sri Lanka wanted to do a private practice and there was a strike and all that. When you were in the 4th or 5th year medical school. But now, at least in the US, it has been totally transformed into a profit-making industry. Medical industry, the largest industry
Are you
in the US. And there's so much corruption, sort of very sophisticated corruption.
But I also get involved in
We have a system here
AI management.
called managed care.
I see.
So whereas when, say for instance, the senior patients like us, the government gives us an insurance called Medicare.
There is a program.
If you work for a certain number of years, you get that.
Living with
So now
I'll give it to you.
there's millions of those patients, and there are some companies that say, all right, we'll take care of you. We'll take care of the total patient. You don't have to pay. Otherwise, the system here is you pay piece by piece. Say a doctor is paid for one service and then hospital for another service like that. But here the private company says, you give us a monthly block amount of money and we will take care of the patient. We'll find the doctors, we'll find the hospital. It's called managed care. I think Bill Roy and those in America know about it. Okay, so the company takes care of yours and gives you all the services you need. Now, the amount of money the government pays the company depends on how sick you are. Not for when something happens. Say, you may not go for a whole year to the doctor, but if you are generally healthy and you just have hypertension or something, they'll pay you X amount of dollars. But if hypertension and something else and something else and something else and something else, for every disease they add more money. So there's a company called United Health, which has 10,000 doctors, which contracts with the hospital. So they have a AI program, medical records program, AI program. In order for you to close that program to say you have seen the doctor, the patient, you have to go through diagnosis and say whether you have it or not. So they put all kinds of diagnoses. Okay? For instance, you have a little loss of hair, they'll call it alopecia, and there's a code for that. You are a little obese, they'll say put obesity. All kinds of things. And and they'll, unless you do that, they don't know how to close. So each patient is now much sicker. And I know one patient who had 47 diagnoses.
This Carmen, one question I have is, what about when you are really old and you have got to go to a home? You have to be cared in a home unless you get a massive heart attack and die and you are found dead in the morning. But in situations where you have got to be cared for at your old age, what kind of costs are we talking about in USA?
Pretty expensive, Bhajan. What do you say? I don't know. It depends on the area, depends on the place. It's very varied. It's all private sector. I think the government Medicare allows you 150 days in the hospital for the lifetime, and then about 30 days in the skilled nursing facilities. So there's the hospital, then the skilled nursing facilities, and those are the only two places they'll cover. And in order to be in the skilled nursing facility, you have to have a certain level of income. You have to be post-hospital. You have to be in the hospital and discharged. After that, if you're old and you get demented and you need to be cared for, there are a number of homes, but they are pretty much from all over the world. 5, 6, 7, 8,000. Most people can't afford that. Tharo, you know how much?
Did you say 6 to 7 to 8,000?
More than that, I think. Yeah.
More than that.
They essentially see how much money you have and
but AI is part of my life.
You transfer your savings to them.
I have given 2 lectures.
Saro, you have any clue?
And
you're muted.
No, not really, Akave. Yeah.
But it's pretty pricey. And then there's a whole bunch
without the insurance,
told me go and attend.
All the people are covered by Medicare, everyone?
Nice meeting you.
Oh, here in America? No. Only Medicare.
So what about children and school going, adolescents and all? No cover.
So for children and so on, the insurance comes through your work mainly. If you don't have work, the state pays for it. And that's one of the things that's happening now in the big fight that's going on in the country. The state is wanting to cut it off. Trump wants to cut off the insurance for the poor folks, the Medicaid. He wants to make
Right,
sure
the trillionaire.
work or something. Yeah, because he wants.
They die. They die.
Huh? We have a very, our corruption is not at the individual level, easily identified, like what Sam said. Our corruption is at the systemic level of the government itself.
Because you see, now we have in Australia Medicare for everybody, free from birth to death. Yes.
Free
You
to
can go
born and
to
free to die.
any GP or
What's happening,
into the
brother?
hospital.
Excuse me, what's happening?
Not like in law, you can't see a specialist.
Yeah.
And
Salah.
then
But the
afterwards-
Medicare covers,
Afterwards, right?
even when you are referred to a specialist, the specialist
Yeah.
one part of
Lunch,
the Medicare pays and the rest
lunch
of it
break.
you have to pay. But
Break now.
the general,
Lunch, yeah, it's happening now.
everybody,
That is-
like if you go to a GP or something,
Go
Medicare is
outside.
free.
There's stairs you need to go
And you
down.
can go into any state
I'll
hospital,
find
it
my
is
way to-
emergency,
I have a
free,
meeting.
covered by Medicare, as long as you are and the Medicare is given as long as you are a citizen. Hold on a PR.
You watch out. A lot of people will try to change it. The whole world, the system of medicine being a profitable enterprise is creeping. I think that's happening in England, right? In England too, I think the private sector is increasing, and all you have to do is to get some legislator to cut out the amount of money for the public sector. That's what happened here.
But you know, the best is Sri Lankan, it's all free, no? You see, we don't appreciate it, the free education and the free health.
Absolutely. No, that's true.
Absolutely fantastic. Whatever
Absolutely.
that is there, you can get it.
No,
Now,
no.
because of the financial crisis, there's a problem, but excellent otherwise.
So what is the story in England? Is the private government sector, they say, is in trouble?
Yeah.
Well, government sector is like this in England, Karunian. If it is an emergency, you will be seen promptly. Now, for instance, when you say emergency, if you go to, we call it casualty in England, instead of, we all call it emergency room or whatever. If you go to casualty, and if you tell them that you have got chest pain, they'll take you on straight away, right? And they will attend to you straight away without any delay. But if you say you got a cut on your thigh or some non-little cut, you could be there for hours. But emergency situation, you'll be attended to straight away. That much is true. But if it's a routine operation, you got to get something done, routine, like say a hernia repair, say, you could be waiting months. Unless you get it done privately, then of course you can get it done in days, for which you have got to pay separately, because the consultants in UK, they work on a different system in that most people work only 3.5 days a week. 3.5 days a week. Other 1.5 days and on Saturday, they work in the private sector, and they will see patients, and they'll see you, and if you have got a hernia to repair, they'll bring you in the following day if necessary and have it done. Then you got to pay for all that treatment totally. But if you wait for the state sector to do it, it could take months. So even a thing like a knee replacement, I remember when I was running the pain unit there, if you got arthritic pain in the knee, the GP knows that the patient has to wait months and months. They would get referred to my clinic, and I would keep them going with intra-articular injections or steroid and local anesthetic, that kind of thing. Keep them going until they are called for surgery. That is how the system goes there.
Out in the US too, if you have an emergency, true emergency, when you go to an emergency room, they can't ask you what your insurance is. They can't by law. They have to treat you. But after treating it, they can bill you. So the commonest cause of people getting bankrupt in the US is healthcare bills. and debts. So it's a huge
Yeah.
issue.
Now, Karnian, say I went to the US. I went to US on holiday. I go to hospital, and they won't ask me, "Do you have insurance?" Right? They'll treat me, and then what happens? They send me a bill, and I don't pay. Then what happens?
They'll come up to your house, your
So
dog, your cat.
left the country. If I have left the country,
Yeah, but you have to manipulate. So, I'll tell you a story. There was a Sri Lankan guy, older gentleman, about 65 or 70, I forget his name. This was about when I was actively practicing here. That was about maybe about 20 years ago, 25 years ago. Okay. He knew his nephew, his son-in-law knew me, and he had a thyroid problem. So he called son-in-law, "Can you see my father-in-law?" He had come from Sri Lanka, but he had brought a travel insurance. Okay, that's the only insurance he had. He had come from Sri Lanka, a thin gentleman. He came and he came to my office. I was in my office, and he had a visible, almost visible, pulsating, mass in the abdomen.
abdominal aneurysm.
Abdomen, huge abdominal aneurysm.
Right.
So the guy had only the medical insurance. I mean, the travel insurance. So how do you get him in? Okay. And you go to do ultrasound, they'll ask you what's your insurance and so on. And he didn't have so much money coming to Sri Lanka. So fortunately, we had a fantastic vascular surgeon, a cardiac vascular, a Sri Lankan guy called Mahendra. He studied in Colombo Medical School. He is also practicing in our community. And I had some other people who are anesthesiologists. Okay. And so I said, let's think. He was asymptomatic. So I said, come and we'll think about it. And I called him. I called the surgeon. I said, he does a lot of good work. He does free work and all that. I said, Panal, I have this patient. Can you help? Can you at least evaluate and see whether he needs surgery? So he said, okay. And I said, tell the emergency room to call me when I told him I'm going to send him to the emergency room. So, and then there was an anesthesiologist. I told him all that this guy is coming, try and do anesthesia for him. And then I told the patient to go to the hospital and say that he's having abdominal pain. Okay. And then for the hospital to say, for him to say, his doctor is me. Okay. So he went to the hospital and said, I'm having sharp pain and all that. And the doctor, of course, I knew the guy in the emergency room, doctor also, I knew him. He put his hand on the belly and he got excited and he called me and said, Arul Machan, Machan, he was an American guy. There is a patient like this, he's going to rupture his aneurysm. I said, yeah, get call Mahendra fast. So Mahendra came and he had the surgery and he was admitted to the emergency, the ICU. He stayed and he had a huge bill. Now, he had travel insurance, so the hospital was trying to collect the travel insurance. It took about 9 months or 10 months for them to finally collect something. But the travel insurance paid. But then they went after him. But then in the meantime,
what would have been the total bill for that? All that?
that now, Majan, that I don't know. It will come to $100,000. I don't know. I don't know what it is. It's very expensive.
Really?
I don't know whether anyone else can pay. Milroy, how much would the bill have been?
Must be at least 100,000 because
I was in Jerusalem when
everything. Easily.
I was in Jerusalem when Salima had a myocardial, spasm, coronary spasm, 100%. And then I took there, and that lady said, give us 15,000 pounds in advance for us to open a file. There was a chap in the ICU who was willing to do the thing is just get the file organized. And an anesthetist came and said, don't worry, they won't open in a hurry. Come, I'll come with you. He came, he told them they have travel insurance. You just register and send the file. Send the file, and when we took the file and went down, Salima was, oh, I have no pain. That fellow has done everything, and everything was paid by the travel insurance. It was quite good. This was UK registration.
Yeah. There's something I want to tell you. Now it's a little medical. I had a message from the daughter of a friend of mine to say her father had been on vitamin D3 and K2, 5,000 units of vitamin D3 and 100 or 200 micrograms of K2. And they did a blood test to check the vitamin D3 levels. They do a thing called hydroxyvitamin D, I think. And it was hydroxyvitamin D, that is the level, that's what they do in the blood.
25, they do 25.
Sorry?
The measurement for vitamin D is a 25 hydroxy, the first
25 hydroxy, yeah, that's right, that's the one.
There is 25
and only,
there are two. Huh?
And it was only 19. And I said, that's insufficient, that's very low. But this is a guy who has been taking 5,000 units for the past 2 years. So I was thinking probably what is happening is D3 and K2 are fat soluble vitamins. I mentioned that I think some time ago also. They are both fat soluble vitamins. If your diet has very low fat, they may not get absorbed. So it is, I mentioned it in a note, I think, to everybody. If you're taking D3 and K2 and coenzyme 10, make sure that you eat some fat in your diet. The best fat to eat is avocado, which is a healthy fat. Mono and polyunsaturated fats with your meal, and then take your D3 and K2. Or if you are having it in the night, take some walnuts, which are also fatty, and also because they contain melatonin, you can get a good night's sleep as well.
Oh, that's a very important information. I am taking D3 4,000 units and K2 125 micrograms a milligram. Anyway, that
but Sam,
I don't take fat.
Has that been replicated?
What's that?
Has that been replicated? How do you know it's not a lab error?
Sorry?
Has that been replicated? Have you done it the second time? Because for one thing, 5,000 is a lot of vitamin D.
Yeah.
No, the thing
even
is...
4,000 is too much, Maru. You can get vitamin D toxicity.
I don't agree, Karunian, because people who are on 4,000, they are 25 hydroxy runs at around 45, 50. Because to reach toxic levels, you got to go over 100.
90, yeah.
90 or whatever, but 50.
I take 1,000 international units daily.
Now, what is your D3 level? 25 hydroxy D?
I did it once ago. It was almost 75, 80. So
that's very good.
I was busy.
I know. So the point is, it may be the type of vitamin D preparation.
Yeah, attending a conference.
I don't know. There are so many variables in that preparation and so on.
At the same time,
so 5,000 is a lot.
It came online.
But that's what they give in US now. For instance, you can't get 4,000. You get 5,000 and K2.
You can
in US, because I know somebody in US is having it from 5,000 plus K2 to 200.
What do you have? I go to Costco, it's 1,000 international.
Sorry?
What do you have? I go to Costco and buy, it's a 1,000 international. What do you get, Milroy?
I know.
He gets it from Amazon.
Huh?
He gets it from Amazon.
Yeah, we'll talk in the evening, yeah.
And what do you get?
So,
what do you get? 1,000?
The other point I wanted to make was the fact that taking vitamin D3 alone is unsafe, because it increases the absorption of calcium, and the calcium could linger in your blood. And you want the calcium to get to your bones and teeth, for which it is essential that you take vitamin K2 along with it.
Okay.
Yeah, K2.
So always take the K2 whenever you are taking D3.
Okay, I must go and check it up.
You just check it up. What about your open evidence?
Yeah, you want me to do it now?
Yeah, do it now. Why not? These are
Okay,
time to find out and clarify.
These are marvelous. It's so fantastic, these open evidence. You know, it has helped me. I mean, I'm using it every day. Has anyone else used it?
Look at it and see about the K2.
Okay. So I will ask two questions, okay? 1 minute. Everyone knows about what open evidence is?
Yes, it's a
Why don't you give a...
medical record system.
No. It's a AI, medical AI, powered by Mayo Clinic and the New England Journal of Medicine.
Is there.
So
Open
what is
evidence.
so define the question you want to ask, Maru? I mean, is vitamin A, does
What is the role of vitamin K2 taken with vitamin D3 or something to that effect?
What is the function?
Function of
What is the advantage of adding vitamin K2?
Function of vitamin
K2.
K2.
Normally,
by the way, Sam told me
try this.
intermittent fasting is good for memory loss. I looked at this one, it immediately said yes. So I've been trying to do that now after Sam's prescription. K2. K2. What's the function of vitamin? Let me say. 1 minute. Vitamin. Oh, I put vitamin.
Vitamin K2
The more that
K2.
vitamin D3 metabolism.
Yeah, K2. Okay, that's number one. Okay. Does it interfere?
No.
Okay.
Benefit.
With absorption of vitamin D?
No, it does not. No, it does not interfere with that.
Benefit.
D3 is really to absorb the calcium into the bloodstream. The role of K2 and K2 also, as I mentioned last time, there are two types, MK4 and MK7. Role of K2 is to take the calcium to the bones and teeth. You can ask.
So why don't I just leave it with vitamin? What is the function of vitamin K2?
Just ask that specific question.
Okay, all right. Here you go. My open evidence is working.
Wonderful.
Lawrence, do you use it?
They want an American registration.
Okay, all right. So I'll read the answer. Can I give the answer?
Yeah, do.
Vitamin K2 has multiple physiological roles. Clarifying your clinical context will help focus of the research on the most pertinent aspect. There are multiple roles. Are you interested in vitamin K2 function in bone health, cardiovascular disease, or any other specific context? Is your inquiry related to dietary supplementation deficiency states?
Vitamin D absorption.
Okay. Do you require information on the patient? So I will ask. Okay. I am interested in bone health and cardiovascular disease. Okay.
Yes.
Yeah. Interested.
Yeah, Arunian.
Yeah.
Yeah, I'm taking K2 for a long time. What K2 does is it removes calcium from the arteries or any other source, and it directs it to the bone. So it goes to the bone and helps with the bone metabolism along with D3. Main thing is to take from the other sources and take it to the bone. So that's why you have to take it to osteopenia, osteoporosis it helps, cardiovascular because it's removing the calcium from the arteries, and also it's supposed to increase diabetes, insulin sensitivity. So the three factors.
So how do you take that? Well, let's just see what open evidence is working on. It. Hold it. Open evidence is searching the medical literature. It goes through all the medical literature and gives it.
Normally the person we talk
really, Saro, you use this. You don't.
At least you know.
Do you know open evidence?
I haven't been using it all this time, but I think I will start.
It's
And in
fantastic.
terms of the K2 Karinian, is it like the dosage, is it weight related or age related, or is it just a standard thing?
Yeah,
Standard dose.
Dose is 100 to 200 micrograms.
So, but we can
Standard,
ask that
yeah.
question. We'll
So
ask.
should you be on the lower end of the spectrum or higher end of the spectrum, depending on what? 100 or 200?
Well, I think they say
Commonly it is
minimum of
100.
100.
Huh? Sorry.
Usually it's 100, but sometimes some of the combinations do have 200. What I use as is 100, 4,000 and 100. My point was not to take vitamin D on its own. This is the point I wanted to make, that vitamin D will increase the absorption of calcium, and calcium can just linger in the arterial system and, get deposited in arterial walls. And to always make sure you take K2 with it to make sure the calcium gets to the bones.
Yeah, right.
So what about they comes as vitamin D3, no, most of the time?
What's that?
What is that? Vitamin D3.
There are
vitamin D3 with magnesium.
No,
listen.
magnesium that plays a different role.
Yeah.
Magnesium, you can take D3, but I'm
so
just
vitamin
saying.
D is what? D is the same as D3 or something else?
No. There are two kinds of D, Benita. D2 and D3. D2 is the D2 that is produced by ultraviolet light on your skin. That is the naturally produced D2 from the sun. D3 is that which is absorbed. Now, when the vitamin D is absorbed in the liver first pass, it gets becomes 25 vitamin D, 25 hydroxy. There's a 25 hydroxy. That is the vitamin D that circulates around. But that is not the vitamin D that really gets the bone. In order to get to absorption of calcium and to modulate calcium mechanism in interaction with parathyroid, vitamin D has to be converted to 125 vitamin dihydroxy vitamin D. 25 hydroxy vitamin D is that which circulates and is measured, and we look at deficiency based on that. But the effective vitamin D is called 125, which is produced in the kidney. That is why in kidney failure you have bone disease. So when you have 125, the one that then modulates the calcium absorption from the gut, and it also decreases calcium absorption, increases calcium absorption, and then the calcium level itself is modulated by parathyroid hormone (PTH). So it's a very fantastic interaction of all the hormones. But certainly,
but isn't with the COVID that they said that it should go up to 4,000?
Yeah, they thought the vitamin D can have. The open evidence is searching for is reasoning. So open evidence was searching all this time. Now it is saying reasoning. Finish researching. Prepare final report. So shall I read the K2 what it said?
Yeah, do.
Okay. Function of vitamin K2 in human health. So I asked for bone health and heart, but it did everything. Vitamin K2, menaquinone, is a fat-soluble vitamin that plays a central role in regulation of calcium metabolism, with the direct implication for bone health and cardiovascular disease. Just also what Sam and Milroy were saying.
Yeah.
Unlike vitamin K1, phylloquinone, which is primarily involved in hepatic coagulation factor activation, vitamin K2 is more effective at the carboxylating extrahepatic vitamin K dependent proteins such as osteocalcin and matrix cal protein. These are osteocalcin is a protein in the bone. So let me read it again. Vitamin K2 is effective in carboxylating extra vitamin K dependent extra hepatic vitamin K dependent proteins such as osteocalcin and matrix, which are critical for bone mineralization and inhibition of vascular calcification, respectively. So both these, what Sam and Milroy said is right. It inhibits vascular calculation and increases bone vasculation, vascular thing. The clinical relevance of vitamin K2 has been increasingly recognized in the context of osteoporosis prevention and management, as well as in modulation of vascular health, particularly in population at risk for bone loss and cardiovascular disease. This report synthesizes the current mechanism.
Menopausal people.
No. The cardiovascular, particularly in population at risk for bone loss and cardiovascular disease. Can you hear me? Can
So
you
that
hear?
is menopause, postmenopause.
Yeah, postmenopause also.
That's why I said menopause. It's
So
very
this report synthesizes the current mechanistic, clinical and safety evidence regarding vitamin K2 with a focus on its function in bone health and cardiovascular health, and provides quantitative, actionable recommendations for clinical practice. So mechanistic action on vitamin K2 on bone and cardiovascular health. Bone mineralization and bone metabolism. Vitamin K2 acts as a cofactor which is essential for post-translational carboxylation of osteocalcin, a protein synthesized by osteoblasts that binds hydroxyapatite to the bone matrix. Only, okay. Clinical studies constantly demonstrate that vitamin K2 supplement releases osteocalcin and indicating so much. Bone health is important. I mean, it's a lot of technical stuff. If you want to go through it, I can go through it. Then inhibition of vascular calculation. In the vasculature, vitamin K2 is required in the carboxylation and activation of MGP. Anyway, it is very good, as these two guys say. Now, question is, what are the sources and what are the doses? Can someone help us with that?
This
I mean, it's a
there's
long article giving all the references and so on. But
It's
the
a
bottom
supplement.
line, what Sam and Milroy said, thank you, Machan. Thank you very much.
What about any contraindication
this
for using?
Arunian, there is also another point that I want to make. K2 also, there are two types, menaquinone 4 and menaquinone 7. I think you better ask open evidence about MK4 and MK7, what is preferable. Because I have read that it is MK7 that is necessary more than the MK4. Would you ask OE what do they say about menaquinone 4 and menaquinone 7?
Okay, I will say that, but before we go that, practical, what are the sources and what are the doses? Can someone say what is the source?
I had a bottle here, MK7. The dose is 100 micrograms.
100 micrograms is about the standard dose.
Then vitamin K2, MK7.
Yeah,
Yes, sir.
Yeah, that is the one that is recommended because it lasts longer in the body. I read because there is MK4, so K2 has MK4 as well. You're supposed to take the 7 instead of the 4.
So Maruf, can you put all this summary in a little your AI summary on the Slimo, so those who are not here can also read it?
Yeah, it's being recorded now. When you finish, only I get an email.
Okay, so anyway, my bottom line is very good. So I'll go to the next one. Safety. Okay, now you asked safety and contraindication. Who asked that? Someone said safety. Someone said safety.
Contraindications also.
Okay, safety and contraindications and interactions. This is very important. General safety and adverse effects. Vitamin K supplementary is well tolerated, healthy, and recommended at doses of 7 MK doses MK7 70 to 180 micrograms per day. Your tablet is 100, right? So the recommended dose is 70 to 180 micrograms a day, with rare gastrointestinal effects and no evidence of hepatotoxicity or hypovitaminosis. No significant changes in coagulator parameters or increased risk of thrombotic events have been observed in healthy individuals not receiving anticoagulant therapy. Now, when you say anticoagulant therapy, does that include aspirin also? I don't know. We'll find out.
Could be, isn't it?
Could be. Any contraindication to vitamin K or antagonist. Vitamin K contraindication. Most significant safety concerns arises in patients receiving vitamin K, such as warfarin.
Yeah.
So anything that can significantly reduce coagulation. So those who are post-coronary on Eliquis or aspirin or something like that, maybe.
What about omega-3?
There is another
All the
switch
fellows copy.
near
What's
the.
that?
I don't know yet. I'll read this.
There's a red switch.
So one is, Majan, you can't take this with any anticoagulant. I don't know about aspirin. I'll find out. The American College of Chest Physicians warns increased intake of vitamin K, including can reduce the anticoagulant response, and recommends patients maintain a consistent intake of vitamin K food supplements with any changes prompting more frequent INR that is clotting monitoring. So number one contraindication, answer to your question, Benita, Don't take it with any anticoagulant. Number two.
But Karnian, but then with K, when you say K, there are two, K1 and K2. I think it's a K1 that is more important for anticoagulant activity, isn't it?
No, all this is K2, Machan.
K2, is it?
Yeah. All this is being said about K2.
K2, not about K1.
No, all this discussion we is having is K2.
K2, right? Okay, got you.
Okay, now, one is going on. Yeah, so it's a long article. I mean, I got this in 2 minutes, as you can see. Okay, now, a lot of very interesting.
What about the dose of vitamin D?
Synergistic vitamin calcium only. So inhibition of vascular calcification, it goes on like that. I want synergistic effect with vitamin D and calcium. So it is very positive for bone health. Okay. Then clinical.
So Karunian, just check to see with the omega-3 because why?
Yeah, I'll finish.
Before his knee replacement surgery for 2 weeks, all the people were asked to stop omega-3, saying that allows the coagulation problem comes with that.
Correct. Yeah.
So will that have an effect there?
Let's finish this minute and do that. Clinical efficacy of vitamin K2 in bone and cardiovascular outcome. I won't read the whole thing, but robust clinical evidence of vitamin D pertaining to bone health and postmenopausal women. Multiple mechanisms have demonstrated significantly improved lumbar spine bone mineral density and reduces the UOC level. Okay. Postmenopausal women use significant improvement in bone health. So women in particular have to get bone health is improved. And cardiovascular disease and cardiovascular risk, it again is very positive. Okay.
Yes.
So I think I would recommend everyone to population differences in efficacy. Okay. And it says that postmenopausal population differences it is greatest in postmenopausal women with osteoporosis and consistent improvement of BMD in some evidence for fracture risk reduction. Okay. Most positive studies have been conducted in East Asian population, that is us, particularly Japan and China, and generalizability to Western population remains uncertain. So studies have been done in our population. And it goes on long term. Everything is positive. Contraindications, I'll tell you.
Joining.
Is well tolerated, contraindicated, vitamin K antagonist. The things that reduce the things when you take the medication that which reduces, include supplements can reduce. I got only the password in the email. Interaction with other medications.
Which one are you joining?
Anticoagulants. There is a long thing. If you want, there's a lot of I may be able to take a photograph and put this on the Slimo. You want me to do that?
A quick point. Apixaban is not contraindicated with vitamin K2. It acts on the Apixaban acts on the XA inhibitor, whereas warfarin acts on the vitamin K. So yes, interaction with warfarin, but not with Apixaban.
How about aspirin, Lawrence?
Pardon?
Aspirin, does it interact with aspirin?
Email.com.
No. I can find out, but certainly not Apixaban.
Because I think I'm going to start taking this.
As I mentioned, Karunian, I think it is so important that your vitamin K and the D3 to get absorbed. I mentioned it a little while ago. Make sure you have some fat in your diet because they are both fat-soluble vitamins. And I suggest that you have some avocado, which is a healthy fat when you take these.
Yeah.
Password is
okay. I will put this one on the Slimo thing for anyone who wants to see it.
If you don't have avocado, what happens?
Take walnuts. Walnuts also have healthy fats. There is no shortage of avocado anywhere in the world, Benita.
How much does it
Avocado is
cost?
available everywhere.
Interaction with aspirin, Karunian.
What's that?
No interaction with aspirin. Aspirin is okay. It's only warfarin that you can't take with vitamin K2. Because that's a
Heparin?
small action, warfarin.
Gmail.com.
Okay, gentlemen, I just put it on the Slimos thing. The whole thing is there. I took a picture. Brilliant. Thank you very much, Sam, and all the people who educate, Milroy and Sam. Milroy, you are both very knowledgeable in age management medicine.
Yes.
This one other thing, Karunian, about this coenzyme 10 that I brought up last time. Advantages of taking coenzyme 10. Everybody have read this, that everyone who is on statins must take coenzyme 10. And after the age of 50, they recommend that we all take coenzyme 10.
Q10. Coenzyme Q10.
Q10. Of course, coenzyme 10, as I mentioned the other time, there are two types. Ubiquinone and ubiquinol. Quinol is the one to take.
Okay, all right. Maya, put that also in the Lawrence. Can you check Benita's question whether there is a contraindication with omega-3?
What did you put?
I put HMRF at gmail.com.
Yes.
I mean, this AI is fantastic. How many of you guys use this thing called ChatGPT?
Well, some people, I haven't used it, but I find that they tell me that it's very useful.
Yeah.
But I'll ask you something totally different.
But let's listen to Lawrence's answer before we go further.
Okay. We wait for that.
Saru, you're going to start taking vitamin K2?
I've been taking it for a long time.
Go and sleep.
Yeah.
I have not been taking it.
Yeah, I've been considering it for a while now.
Saru, go and open it. Do you have NPI number?
A what?
NPI number, National Physician Identification Number, the NPI number. If you put it free of charge, NPI is the number that Medicare assigns to every physician in the country. You don't have that? You haven't practiced for a long time.
Okay, password is what? Capital?
A-H-A.
You're muted, Saru.
Mahamu.
Mute because there's background noise.
Yeah. No, you're muted.
Okay.
Yeah.
1969.
Currently, but I know what you're referring to, Saru. I've also seen that report about omega-3 and clotting, but I can't remember where I saw it. But when I put it directly in, it's saying no direct evidence.
So, what is the source you're using, Lawrence?
Or ChatGPT.
Or ChatGPT.
Paid version.
Yeah. But ChatGPT, I can tell you, my ChatGPT on my iPhone and I have ChatGPT on my computer and I am using iPad. I got ChatGPT on my iPad. And sometimes they give you 3 different answers. So you have to be careful. I mean, in other words, they are all relevant, but ChatGPT can be inaccurate. So you have to bring your own.
No capital.
They don't talk to each other. I sign in as the same name, but I get 3 different answers. But
Karunian, they want you to use your own brain as well.
I think so. Thank you for that. Yeah. No, but the way they correlate so much information. I mean, how can you, the information I just read, to cull that from a medical literature would take hours and hours and hours. But yeah, they want you to use medical, but some information you can't get. I mean,
what is happening?
It is really useful in many, many ways. I find it extremely useful.
This other question, other thing I want to make is whether everyone is aware of the dangers of microplastics. which I spoke about last time.
God, yeah.
Because still cut back on the plastic. Use plastic. If you have plastic kettles, throw them.
I put correctly.
Don't use plastic plates or plastic mugs.
Small age.
Try and avoid all that as
Yeah.
much as possible.
Yeah, no, I agree. I mean, that's one thing, but the problem is so pervasive that you really can't avoid it in everything.
No,
I
you
mean,
cannot avoid. You can only minimize it.
yeah, minimize that at home.
All
Yeah,
all the IV drips, all the tubes are plastic.
What's
all
that?
the IV drips and all the saline ones are coming in plastic.
No, the lid is in plastic. For instance, I use some glass containers with put some food in. I'll show you one.
No, what I mean is in the hospital, everything is plastic.
I know. Not only hospital, everywhere.
So then what happens?
I know. You go to the supermarket, it's plastic.
Yeah, but you know, we
It's a glass
export
container.
and then we are using it in the hospital.
You can use a glass container, but the top, if you are cooking something and putting the food in, you put it into a glass container until the food cools down. Do not cover it with the plastic. You see now these are plastic top. So I only cover it after food has cooled down. They say not to put not to cover your hot food with a plastic
that
cover.
will warp. That will warp, isn't it? When it is too hot.
Yeah,
Plastic will warp.
Sam, you know, the problem, I am also becoming aware of it. They find microplastics in everywhere. Everywhere they went to a park and they dug and there's microplastics. Everywhere. It's sort of permeated into the environment. Plastics and it's going to cause a lot of problems. And people related to increased cancer and all kinds of stuff. But on a personal level, as you are saying, you try to minimize it. But even that is only limited, because you go and buy something, it's in a plastic. You go and buy some grapes, it's in a bag that is plastics. You know, wherever you go, all the shopping is wrapped in plastics.
Correct, in that workplace.
No, I mean, that kind of thing you cannot avoid. You can always watch your game. All I'm saying is not to put any hot food onto a plastic plate or a plastic container.
Yeah.
So you can only minimize. You can never avoid it. I mean, the kind of life that we lead today, I mean, we are exposed to all sorts of elements. I mean, there's no question about it. But you can only minimize things. You cannot avoid in this day and age. There's one thing I want to tell you about.
So Sam, today, for instance, just to recap, we decided that you have to take vitamin K2 at 100 micrograms per day. Right?
K2, not K1. K2, 100 micrograms.
100 micrograms.
The center.
Right?
And also, it has to be MK7.
MK?
MK7. Milroy, you're taking MK7, right?
Yes, MK7.
And doing this.
So, Mayan, write it up, put it on the thing for other friends too. But let me ask you a question. Is there any time or with food or anything else that decreases absorption or anything like that?
That's why I say, I mean, when always have some fat, because it is a fat soluble vitamin. Take it with some healthy fats like avocado or walnuts.
So take 100 micrograms of vitamin K2 with avocado or walnuts. Yeah.
Or walnuts. That's the point I want to make. And other thing, one little point I want to make, just which I read only yesterday. These Brazil nuts contain massive amounts of selenium.
And then there is
They recommend that you don't eat more than 2 Brazil nuts at a time, because you can develop selenium toxicity.
No.
Can you read it up with OA, see what open evidence says about selenium and Brazil nuts?
Give me 1 second.
Walnut.
Yeah, they put the meeting ID you put now, just now.
Yeah.
After that, I'll ask you to join.
Okay, now. Yeah, that.
What is
Yeah.
contains selenium?
02.
What is the question, Majan?
My question is the what is the safe dose of selenium?
Brazil nut.
That is one. Second question is how much of selenium in
140.
Brazil nuts?
Okay.
Correct pass.
What is a safe dose of selenium?
2.
How much of selenium is there in Brazil nut?
I'll let it again. 0, 0, 1, 9.
He's thinking now, Majan.
No, 19.
Analyzing now.
So what do we need selenium, Sam?
You need selenium for all sorts of bodily functions. I mean, but you
I
need it
know,
in
because you see, people.
micrograms, really. But they say if you reach a certain level, you can reach selenium toxicity, which can affect your nervous system and gastrointestinal tract and things like that. Because some people eat a lot of Brazil nuts. I have read that there's a huge amount of selenium in them. So you have to be careful.
It will come now.
So can
You
I
see,
tell this?
because macular
Okay,
degeneration,
read it now, Karunil.
Huh?
Read it.
the
Found
people
it.
Shall I
with
read it?
Sam, so people with macular degeneration are given selenium.
Sorry.
Okay.
Macular
But-
degeneration, ARMD, age-related macular degeneration.
Yeah.
One other thing that is supplementary is a selenium supplement.
No, I know, I agree. No, you must never reach toxic levels of anything for that matter.
Okay, so
So
shall I
it is
read
important
the
to-
answer? Sam, shall I read the answer?
Yeah.
Safe dose of selenium for adults is 255 micrograms per day. Okay, this is a safe dose. Okay, I don't want to read everything. The
Right.
amount of selenium present in Brazil nut is highly variable depending on the geographic origin and the soil selenium content. Most analysts report that single Brazil nut typically contains 50 to 150 micrograms of selenium. So 255 per day is the dose, and a single nut can have between 150
That's what I read.
150. But individuals with nuts can grow as low as 10 to 20 to high as 400. Okay. So median values of multiple studies that suggest that one Brazil nut often provides the full daily recommended dose of selenium. And in some cases, a single nut may approach or exceed the limit. So you can only get one Brazil nut.
Yeah,
Given this
so because there are
regular,
people who
given this variable, regular consumption of multiple Brazil nuts per day can easily exceed the upper safe limit for selenium. So you know one nut, Machan.
Yeah, that's what I'm saying, because they have so much of selenium, because there are people who eat 7 or 8, 10 nuts of those. You can reach toxic levels.
So why
Selenium in walnuts. 2 walnuts meet your daily requirement. Or 3 walnuts, sorry. Walnuts is the easier source.
So shall I say what are the common side effects of selenium?
Yeah, please do.
Okay. He's thinking. My AI is thinking.
Low.
Now he's analyzing. Now he's telling the answer. Common side effects of excess selenium intake, including from dietary sources such as Brazil nut, are hair loss, alopecia, nail changes, or loss of garlic-like odor to breath, gastrointestinal symptoms, and neurological symptoms such as numbness, paresthesia, or hands and feet. Chronic high intake can lead to selenosis, which is characterized by these severe cases, by these symptoms, and in severe cases may include fatigue, irritability, and rarely more serious complications such as abortion or edema, and so on and so forth. So Brazil nut is a big problem, and so essentially the common thing are Machan, hair loss, nail changes, gastrointestinal symptoms, neurologic symptoms such as numbness and paresthesia. So and severe it can cause irritability and all that. Okay. Okay. So I have selenium poisoning. I have hair loss. I have irritability. Maybe. Very good. Fantastic.
So that's one of the things I'm going to say.
Sam
Don't use more than 1 or 2 Brazil nuts if you do. But walnuts you can have 30 grams of walnuts. You have 8 to
No,
10 walnuts is about 30 grams.
6 walnuts a day.
Yeah, 6 to 8, because they contain melatonin. Take them in the night, because then you can have a good night's sleep, because walnuts contain fairly high levels of melatonin.
So shall I write an answer? What are the benefits of taking walnuts? Shall I write it?
Yeah, do.
Write it and read it for the benefit of for the AI.
So do these nuts have only one type of selenium or melatonin or something like that? But some nuts must be having high concentration of one and little of the others. So why are we identifying one in each?
Yeah, but we don't want to talk selenium toxicity by eating 10 Brazil nuts.
No, it's not selenium toxicity, but if you take
Okay, all right.
walnut,
Can
the
I
little
give
bit
the
of it that
walnut?
comes up with that
Yeah,
should be a
walnuts,
substance
tell us
after.
about walnuts, Carnian, so that we all know.
Healthy benefits of walnut, consuming walnuts are primarily related to cardiovascular risk reduction, lipid profile improvement, potential benefits for metabolic and cognitive health. Multiple meta-analysis of systemic reviews, randomized control trials demonstrate regular walnut intake leads to significant reduction in total cholesterol, LDL cholesterol, and triglycerides without adversely affecting the HDL cholesterol or body weight. These effects are most pronounced in individuals with elevated baseline cardiovascular risk, dyslipidemia, and are observed with daily walnut ingestion of 10 to 99 grams. Walnut consumption is also associated with improved endothelial function, reduced oxidative stress, anti-inflammatory effects, which may contribute to lower rates of cardiovascular events and all-cause mortality. Observational and interventional studies further suggest an association between walnut intake and reduced risk of type 2 diabetes, as well as favorable changes in plasma metabolites. Emerging evidence indicates that walnut may have beneficial effects in cognitive function, gut microbiome, composition for cancer, and all kinds. Everything is good. But about sleep, I haven't said. But in summary, most robust, consistent benefit of walnut consumption is the improvement in lipid profile and reduction of cardiovascular risk.
I'll be a few minutes here.
Yeah. Now, shall I write, does walnut help to...
Yeah, but can you specifically ask about the melatonin content of walnuts?
Yeah, does walnut
Contain melatonin.
help sleep? I'll ask that way. Okay.
Well, lie down, I'll come.
Let melatonin. What is the question? Melatonin like components.
No, melatonin components.
Also, any difference between roasted and raw in terms of whatever the contents are or whatever is better?
Is raw? Is there a difference?
In using walnut raw or roasted?
Roasted and raw. Walnut. Okay, all right. Very, very useful meeting today, Majan. I'm going to change my diet. I'm going to eat melatonin.
Sam is at the end of it.
Okay, walnut consumption may modestly improve subjective sleep quality, but the evidence for direct clinically meaningful effect on sleep is limited and not robustly established. Okay, so that's okay. All right, and they go on to the recent randomized trial. Walnut contains a melatonin, melatonin with measured concentration of around 3.5 nanograms per gram, and animal studies have demonstrated that walnut ingestion can increase circulating melatonin level and serum antioxidant capacity. It can, however, absolute amount of melatonin provided by typical serving of walnut is orders of magnitude lower than pharmacological melatonin doses used for sleep induction. So there is some melatonin effect, but it's lower than the pharmacological melatonin dose for sleep induction.
Right.
And current clinical review emphasize that melatonin content of walnut is unlikely to produce significant physiological effect in human sleep. Okay. Then there is no high quality evidence that roasted and raw walnuts differ meaningfully in their melatonin content or sleep related effects. There is no difference, Mr. Rao. Okay, so it may improve sleep quality. If you believe it's going to help sleep quality, it will improve. Because Manan, the belief system, Lawrence can tell us, very important variable. So-called placebo is not.
Placebo.
Lawrence, you must give us a talk on placebo effects.
Placebo and nocebo.
Yep.
I think it's due already.
This,
Lawrence has escaped one or two meetings. We tried to catch him.
yeah, I mean, all I wanted to say was now, in any case, the melatonin levels are supposed to increase in the night, and this taking walnut might tip the balance in your favor. Of course, as you get older, your melatonin levels also drop. You got to accept that.
No, I know, no question, yeah.
I have a question for something that I didn't know and I have read. Do you know who is a mammal? Can you describe a mammal?
Sorry, we are working with who?
Mammal.
I think it is someone where the young is given fed milk by the mammary gland.
Yeah, mammary gland. But
It gives birth to a child. It births to
I used to always think the mammal is something that had 4 limbs, but it's not the case.
No.
It's a
The mammal is someone who can produce milk. The female can produce milk. And second is mammals have a diaphragm with the lungs and the heart in one section and the rest in another section below the diaphragm. Only mammals have diaphragms. Something I was curious about, and I was reading, and I thought I used to earlier think mammals are the ones with 4 legs, which is not the case.
mammals are the ones.
No.
Mammals are breastfeeding.
Yeah.
Mama is anything to do with breastfeeding.
That's right. You see, babies are born.
Because I was listening to a guy called David Sinclair at Harvard. He seems to think now, because whales live for 200 years, roughly, that humans someday will be able to live for around 200 years. That's his belief. He's doing research on that.
Yeah, because this is a well-known thing. The number of telomeres you have is 22 when you're born. Each telomere can live between 7 to 10 years. So 7 years is 154. And we, of course, knock it off in half, less than half.
Well, I mean, so many factors, genetic cause.
I know there are so many factors. If you one of these things that have been talked about is tension and stress can cause the cell.
Manan, if you want Trump to live for 150 years,
Sorry?
I'm glad some people die early.
Well, I mean, they say in 1900, the life expectancy was something like 47 or 48.
When we went to medical school, 1940s, life expectancy was 47. When I was born, when I went to medical school,
means
it had
each
gone to
telomere was living only 2 years.
Yeah, but when we went to medical school, it was 62. The main reason for increase in life expectancy in Sri Lanka was control of malaria.
Control
malaria.
Control of malaria was one. Second is, of course, availability of antibiotics, which was not there until the 1940s.
Yeah.
Because so many people died because of minor infections.
Yeah.
Because I was also, I mentioned last time about to look after your skin microbiome, not to use all these industrial soaps and things like that, which can damage your
Drink too much
microbiome.
cold water.
But Sam, can you do me a favor and do us all a favor? Without giving the physiology and the anatomy and the pathology, you have some very specific recommendation, like not putting the plastic thing on top, not using the skin thing, using walnut. Can you put 1, 2, 3, 4, 5, 6 so that it is not a long thing, and put it on the Slimo thing? Write it down specifically, just the recommendations.
Yeah, I will go through it with Maru. He's also AI is also recording all this, right, Maru?
Yes, it is.
But
it is.
recording, Majan, we have a lot of stuff. We have talked a lot of stuff.
Yeah,
But
yeah. The whole
No, we
discussion.
have to extract out of that the important ones.
No, AI will do that.
Yeah, so we can go through our Maru. You send what AI has produced, and then I'll tone it down to a point form.
Okay.
Majan, I'm working with a couple of guys, young guys, on a AI project, medical project. It is already exists. He's trying to get another one as a less expensive thing. But already this what we are trying to do exists. Is nothing new. But what it is when you see a patient and you talk to the patient, say I see endocrine patients, diabetes, how long have you had, and all this kind of stuff. And I have a chat with the patient. It listens, and I have my iPhone on. It listens, and it gives you a summary.
Yeah.
And if
I'm
you
at
say
an AI meeting just now.
I know, but it's a fantastic summary, and then it'll give the medical records there is organizes the SOAP. You know what? Subjective, objective, assessment plan, and then it'll give a plan and what you have said, and you can edit it and so on. So now sometimes I only talk and say I do some telemedicine, and then I don't see a physical thing. Then I said physical exam not done, but the patient was cognitively aware, alert, and said that there was no symptoms, and many of the symptoms normal or something like that. I say it'll put all that and put it. So at the end of it, you have medical records. But the thing is how it extracts significant part of the conversation, because I will ask, what are you doing, where do you work, all that. It is amazing. Just amazing.
How is your intermittent fasting going?
Manan, I intermittently fast. so I have not got into a habit, let me tell you. Partly because of social life and so on. But it is no question. But I often miss a meal. It's not systematically. Now, I was trying to start to do from 6 p.m. eat the dinner and eat 12 noon lunch, so that there is only a 18-hour fast. That was my initial thing. But you go for a breakfast meeting or something like that, it gets screwed up. So it has, and then I've sort of lapsed back into the whole thing. But I still eat twice a day or something. I'll eat less, eating less for a meal. So I must say it has not been very successful, only because I haven't formed a habit. They say that it takes 63 days or 66 days for an old habit to break and a new habit to form.
Yeah, so, you're right. It took me to about a couple of months to get to this habit.
So it's got to be a habit, and I haven't succeeded in doing that. But I've intermittently fast.
I fast on Mondays and Thursdays.
Now that is also a form of intermittent fasting. You can do that.
It is. I mean, there are all types. Now, what I practice is what is called TRE, time restricted eating, which is one of the types of intermittent fasting, which are fast for about 15 to 16 hours. But of course, you can have your black tea and green tea, which contain nice polyphenols, antioxidants. But the actual proper meal is around 12 after you finish at 8 o'clock or 7:30 or whatever. The next meal is normally at around noon, but I'll have my green tea, black coffee, all this stuff during the day.
So essentially, it is skip breakfast and eat early dinner, which is easy. Not very rigorous, which is not, but it's just a habit and socialization, and you come back from exercising or walk or something. So I have not been able to do that, but it's certainly doable. It's not, but I haven't formed a habit, which is what we have to do.
But that's good. But you're taking your pumpkin seeds, right?
Yeah, Majan, I took pumpkin seeds after you said for about 4-5 weeks regularly. I loved it. I used to put it into my soup. I used to come and consume it. But then I started getting an allergy.
What?
I started getting an allergy.
Really? To pumpkin seeds?
Yeah,
Pumpkin seed.
I'm very allergic. See, I'm allergic to all seafood. I'm
Really?
allergic to some nuts. Fortunately, not cashew or peanuts. So when I started eating the pumpkin seed, my throat started itching. That's
Oh God,
often
that's dangerous. That's risky.
yeah. So I
That,
stopped it. I haven't tried. My wife takes it after I started, but I couldn't take it. Unfortunately, I'm allergy prone.
I see.
I mean, I can't take fish. I can't take any seafood. I don't know the taste of prawns or crabs or any of those things. No, so that's a little problem I have.
Maruf takes it, no? Maruf, you take your pumpkin seeds diligently.
Intermittently.
Intermittently. Well, I mean, I do. I have found that I rarely wake up in the night since I started taking it.
No, we looked it up after Sam said all these things. I go to my open evidence and look it up, and pumpkin seed has improvement on the prostate. I don't know the exact mechanism, but I have a feeling it has some inhibition of the conversion of testosterone to dihydrotestosterone.
It's supposed to be some phytoestrogens or something that is.
Phytoestrogens that inhibits the testosterone effect. The prostate enlargement is driven by testosterone. So it inhibits that in some way or form. So that's the good part, yeah. Sam, I will do a little bit of practice, and I have a lot of fellows coming and wanting testosterone.
Mm-hmm.
Okay, is that a practice in Sri Lanka? Do you have the aging? It's called there's a new field of medicine called age management, and it's a
Well, they
huge
have got.
industry.
I don't think they are.
They call it anti-age.
There's a publicly traded company called Hims and Hers.
Oh,
Have you heard of that? They even had an advertisement in the.
no, I haven't seen. It's just
They have
that.
all kinds of hormones, and they do all kinds of manipulations.
Yeah, I think.
And so
I think at the end of the day, Carvin, what matters is what you eat, when you eat, you take your exercise. I think activity and longevity go hand in hand. I have a solid example of my aunt's husband. You remember when we did a 6 months course, and then we had a 6 month break before we started medical college. You remember that?
Yeah.
During that 6 months, I taught as a school teacher in a place called Keldenia, and this aunt and uncle, the uncle was the chief jailer at this Pallekali open prison camp, Pallekali. And I used to Pallekali. There's a cricket stadium also there.
Yeah.
By Muralidharan started a cricket stadium there. And I used to be a teacher. This uncle of mine, that guy used to come, eat, heavy lunch, sleep, right? And that's all he did. No exercise whatsoever. And at the age of 49, he got one heart attack, and that's the end of it. And by then the lectures had started in June. The Abesiri, L.U. Abesiri, and my two nephews were boarded in the same house. L.U. came and said, your uncle had a heart attack and died. And his brother, that guy lived in our village. He was a baker. His job was baking the bread and delivering it to all the homes on his bicycle. And all he did was cycle 30 to 40 miles a day, delivering bread. That guy, when he died, he was 101 years old. The older brother died at the age of 49. They would have eaten much the same thing, rice and curry, but activity plays a key role.
No, no question about it. What do you say, Glory?
Sorry?
No, she's trying to find where Teldenia is.
No.
Teldenia, where is Teldenia?
I'll tell you, that is where the school that I taught in is underwater. Mavali River was diverted somewhere there.
Victoria
and
Dam.
Village went underwater. It is on the way to beyond Kandy. It's about 12 miles from Kandy.
Yeah.
And that school is no more because when they put that Victoria Dam, that entire village went underwater. The villagers were rehoused somewhere else. And Pallekele is well known because Murali, our famous cricketer, he started a cricket stadium in Pallekele. That is just about 4 or 5 miles out of Kandy.
I used to work in a school in Periyamadu.
Where was that? Where is that?
That was near Mana.
Uh-huh.
I used to go by cycle from home about 25 miles.
Yeah, so you have been active.
Yeah, through
you have
jungle.
always met
They said there will be elephants. Be careful if you see an elephant, don't go and face it.
Well, I mean, people who go down to the East Coast always face elephants on the way. Only thing is, as long as you feed them, they are happy.
In Periyamadu, you get elephants in that road that I was going to the school. So I go once a week and then stay there. And at the weekend, I used to come.
See, my prescription for longevity and health is number one, people. Okay, you need a community and society and people to talk to, and either your family or your friends or your religious group or your philosophical group or your political group. But whatever it is, you need people to talk to and interact with. Okay, and the second is purpose. You must be able to do something, either study, learn, read a book, write your own story. I mean, one of the things that we can do at our age is to write our own story, because everyone has a unique story. And our children, our grandchildren may be interested in that. You know, that is true. The third thing is health, which is, as Sam said, it is exercise, food, and sleep.
Yeah, I've been reading Benita's book. Benita, reading your book?
What?
Benita's book.
Yeah, Benita's book is fantastic. You know, I read Benita's book. And there's one section of it we should talk about at a meeting, Benita.
Yeah. There was one thing I want to ask Benita about your book.
By the way, before I go, Saro, I'm supposed to send you Benita's book. Benita sent me can you text me your address and I'll mail it out to you. And anyone else?
Sure.
Huh?
Yeah, sure, we'll do.
One of the
It's a
things I want to
fantastic
do
book,
is
Benita.
we have to make a
fantastic
database of all our existing batchmates.
Before we go further, I would strongly recommend you read Benita's book.
I enjoyed reading it. I mean, that's a nice book. She's written so much. And there's one thing I want to ask Benita, now that I have the opportunity. I'm very interested because you mentioned that you went to see some Indian Vakyam or
That is what I'm talking about.
guy.
Yes.
That guy said that exactly what you do and what your husband did.
Yes.
So there is that's exactly why I say we should have a full discussion on it. Because Benita had some way of some guy who predicted the past and the future.
Yeah.
Which implies that what we are doing is already determined. So all the health thing that Sam is saying is of little value. So, I mean, that's a logical thing. But so my question is, can we discuss that? We can, someone at the next meeting, one can read it and then ask to discuss and have discussion. We will all have some experience on that.
I think all must read that book. This is a very nice book.
Yeah, I mean, I've been reading it and I find it really, really interesting because.
So I'll tell Saro.
As if you are Benita.
Saro, Benita.
I thought the PDF came. Glory, did you get it?
No.
Edwin?
Okay, let me tell you. Benita sent everyone a PDF, which is on the electronic form.
No,
did you get it,
I think
Saro?
that was Maru sent.
I sent.
Maru, why don't
I posted the books to them. But
resent
anyway,
it.
if anybody else wants, let me know.
It is buried somewhere in your WhatsApp.
Yeah,
okay, anyway, number two is, however, I have a hard copy, which is in some ways easier and more pleasant to read, and I can send it to anyone in the US.
Yeah, I also will need one.
Okay, Milroy.
Yeah.
I'll tell you what, you send me your address, but I can come and meet you one of these days. We'll go out for dinner or something because you're close to Northreach. So I'll give you a book. I got 4 books left.
Oh, thank you, thank you.
So Manan, send
Give
me
one to
address.
Saro.
So you're mailing me one, right? I like a
Yeah.
hard copy. I like to read these things.
Yeah. No,
Turn the
I'll mail.
pages.
You
go
see,
back.
I'll mail you
the
one.
good part of it is at the moment the publisher sent it. I wrote that. It had been shortlisted for State Literary Award.
Yay.
Oh, yeah.
Oh,
So
Congrats.
Milroy, you also send me your address, Manan. It may be easier for me to just mail it off because I'll go tomorrow.
Yeah, I'll send it. Yeah.
Post office and put it in a little package and send it off.
yeah. Brenda is great, clearly written and easy to follow. You can read.
Oh,
I
yeah.
just read it for a good half hour, 45 minutes in the night. Because you have written 300 or 400 odd pages, I think.
Yeah, I don't know how she did.
No, it's a life history, 8 years of life.
Yeah. That's wonderful to read that.
Yeah.
Your life story from the day you were born.
But you haven't put all your love affairs.
No, not only that, but you see the advantage is
How do you know about that?
in Sri Lanka, from the dean to the others, they took it, all the medical colleges have been distributed. And public libraries have been given the books.
Okay.
Has the medical college library
They have done it. All got.
All got, right.
And schools got. And here in Kilara, in Sydney, quite a few libraries there. The people who read it have gone and given to the libraries and they are having a waiting list to read that. When I wrote it, I thought that next door fellow would read also.
How long did you take to write this?
It's about 8 months. After COVID, sat here on the iPad. One finger typed it off.
I see, wonderful. That's great.
You typed it on the iPad?
On the iPad only.
Okay,
You see, I don't know. I am not
for those who want to
computer literate. I
write.
do it on the iPad. And after about a chunk, I get my granddaughter to save it in a laptop.
Oh.
So that's how it got saved. And when the whole thing was done, then I asked Shanti. You know Shanti Gunawal, Sweetie, anatomy, who was teaching us. She edited it. So, and then the front cover was designed by my daughter, and that got published just about last.
That's a very, very
September.
pretty picture of you on the front.
Yeah, it's lovely.
Quite a lot of reviews have come. So probably I printed 1,000 for free distribution, more or less finished. So the ebook, I have been asked to put up a ebook with all the people who have written the, reviews on it.
Comments, yeah.
So
Why don't you put it on Amazon? Why don't you put it on Amazon?
I don't know. You know what I mean? Don't ask me. I'll ask my daughter, and I think for Amazon, and they said Amazon and Kobo. Kobo is the other one.
No one else.
Two platforms to put. That's what the publisher said. So to put for both. I had never heard of the name Kobo, and the other one is.
I have never heard of it.
Amazon.
Yeah, it's a beautiful
But Saro, you texted. If you text Milroy Saro, you texted to me. I'll put it in the mail today, or not today. In the next.
Yeah, but Glory, if you're UK, I can send about 5 books or something like that. If you can distribute within your friends.
Yeah.
So, can we have a discussion of Benita's book at the next meeting?
After you all read, then we can have at least have a hearty laugh.
I think we should give two sessions before we start.
So one session we can just talk. Unlike
next session we just talk. Whoever has touched on.
Yeah, we can talk. Yeah, about that.
Go to ChatGPT
Benita,
and find out. Lawrence,
a book for me.
Lawrence, go to ChatGPT and find out whether what is the name of the fellow who predicts from the leaf, Ola leaf.
Yes, that is a Nadi Vakyam. That is Kanda.
I'm really interested in the Nadi
Sri Lanka.
Nadi Vakyam things they predicted.
Nadi Vakyam Kanda.
Yeah, those guys are not available here anymore, are they? They were here some.
Yeah, they are in Sri Lanka.
Are they there still?
Yes.
Yes, they are still in Sri Lanka. Yeah.
They are still in Sri Lanka.
Yeah.
How do I locate them? They were
Benita,
in
do they
I
do
can give you the,
teleconference?
I can give you the address and the phone number.
Can you send it to us or put it on
Yeah, I
slide?
can do that. Yes.
Because I was very amazed that those guys said exactly what you do and what your husband does.
You see, the
To
amazing
know you
part,
from
Sam,
Adam.
is not only that, not the setting. To tell the name, you are Benita, you are married to Stephen, and you have got a daughter who is Priyanti, and your son who is Ravi. And one is an architect, and other one is that. Who the hell will know? Everything has been landed.
Oh, I was quite fascinated by that.
Yeah, I know.
And also knowing the name of the uncle, aunt, and everything.
Everybody. And then my son got married, and then wife is a Lienage, from Miss Lienage Fernando. She went, and then they say, you will be getting married to Ravi Stephen, and you will have two daughters, and both will do medicine, or whatever that is. Two daughters, and the first one is now 14 years. And
are you going to come now?
My son came and said, Mommy,
what's going on?
She says she wants to do medicine.
Okay, fine.
Wonderful. These are some of the things we just can't explain.
I don't.
But science
They
cannot.
say it's like a cosmic. It is something like a cosmic. This one, those days, like the Nostradamus. Some Maharishi said that cosmic thing that he wrote. But I don't know why he had to write about Benita and Steve and Karunya and Sam. You know what I mean? Who Professor Panditharatna, he went. Now,
He must write a book about Slimo.
Department,
come for the lunch.
I said his wife was a doctor, two daughters, all names, all given.
Benita will appoint you the chairman of the committee to write the story of Slimo.
If you give me the details, I can. That's not a problem.
Lawrence,
Writing is the easiest one. As we are talking, you write.
Lawrence is the guy, as a medical student, I think he had most interest in these occult and other things than most of us.
No,
I was
Lawrence
not only a skeptic, I was against it in the sense, I thought, looking at this behavior, you're leading your life based on what some guy tells you or some fellow looks at the palms and tell you. I always looked down on it and I didn't want to do it. My family was that. My father didn't want me to do it and none of us did it. So we never went, none of our birth dates and the birth times, because in Sri Lanka, when I was at Casa Street, they'll want to know the birth times and birth date to cast some astrological stuff. I don't know anything, and we never talked about it. We ran it down as a method of living.
No, that is the Christians.
No, anyway,
the Buddhists and the Hindus all check the exact time.
Whatever it is.
Look at the time to have cast horoscope.
Okay. Anyway,
Benita, are these the guys who are in Bellavatta?
Yeah, in Kolpiti. Bambalapitiya. Sorry, Bambalapitiya.
Yeah. We've been to them too. They read this Ola Leaf thing, right?
Yeah, that's right.
A long time ago. But like Karuni, I mean, my family didn't really do anything based on the horoscopes, but we all had them. We were not big consultants on that, but there is a belief in that, obviously, like you said. So anyway, we went there too, and there were some things that they said that were kind of correct. Yeah.
Yeah.
The past is correct.
Go down to eat.
But I'll tell you one little.
Sometimes we have forgotten, but the past is 100% accurate when they get it correctly. But you have to pick it out as they come out with that. Nilani, you read it, didn't you?
Yeah. Okay.
Yeah.
And was it right or was it wrong?
What's that?
Well, we should have a double-blind trial. Lawrence, what is your take?
Nobody can understand how they have to write this, but even here, Aussies, they read it and they seem to have accepted it. Nobody wanted to know, this must be bullshit. Why did you write something? No. They're quite, a lot of people just take it and they accept it as something that happens and they can't explain.
Yeah, there was no indication why you should fabricate it unless you are like Trump.
Yeah,
Trump
no, because you see
Trump not fabricate, he'll store stories.
No, but the fabrication of Trump, that's a different subject. But Lawrence, what is your take? You are quiet. You are having a very very sarcastic smile.
I
like
used to be a high-demand palmist. My biggest customer was Tasim Mahmood, who didn't do anything without having his palm read. Ratapala, Vignesh were all... Anyway, I had a whole high clientele, including the first time I met my wife, who asked me to read her palm and got so angry at the reading, she went and complained to the host who invited that obnoxious man. So
that is, this is not
my
palm reading,
predictions have
Lawrence. This is not palm reading. This is
I'm
Ola leaf.
high validity.
Oh, bye, Sam.
Okay, then bye. Bye.
But my experience is that most people reinterpret what they heard.
No, could not have been because they came from India and we were just.
Okay, so anyway, let's not have a debate on this. Where we
No, we
all have
won't.
experiences and we all have things. Why don't we have a whole meeting on this?
I think so.
Lawrence, will you give your experience? On what basis you read the palm? Do you really think the intricacies of our life can be predicted on some angles of the creases of your hand?
Folds.
Yeah.
Kind of sense. I mean, I have read palms of my patients sometimes when I'm stuck, and it does give you some ideas. I mean, there are useful indicators.
Life.
No, but elaborate on it. Now, I'll tell you a recent example I have. There's a friend of mine, he's a little older than me, who grew up with me in Jaffna, a wonderful guy. He was a permanent secretary in Sri Lanka. He retired and he's living in California. And Sivadasan, for those who know him, he had 2 hospitalizations recently. He had a bypass surgery, he had some heart failure, he had 2 hospitalizations. And I went to Northern California, to Palo Alto, to see my brother. I decided to drop in and see him because I knew he was sick and he had just come back from hospital. So when I met him, he was very happy. He walked down the stairs. He sat and talked to me and talked to me and all. And when I want to leave, he said, I wait for 15 more minutes like that. He was just very happy, chatting about old times, Jaffna, the school and all that. But he said he had a firm belief in palmistry. And he said, look at my palm. I don't have too much time to live. But I could have said he didn't have too much time to live based on his medical condition too. Where he had an ejection factor of 23%, and he had twice hospitalized with cardiac failure. But he firmly believed in it. And he looked at the palm. He looked at my palm also and didn't say anything. I didn't know what he saw. But he also was a fellow who dabbled in palmistry. I then came to England. And next week he passed away. So I don't know whether, of course, medically too he was fragile. But so I don't know, people believe in it, and whether the belief drives the outcome or whether the outcome is independent of the belief, I don't know. But belief is a very powerful factor, as Lawrence knows. Placebo. So anyway, but why don't we have a session on that? That's interesting. And Benita, have you done any more research on to what that issue is?
No, it's just a story wrote. At the moment, no. Because this was to make it interesting, and this is something that caught me by surprise. But then I can tell you something on palmistry. Now, this is Ola leaf. What happened to when we were in Ratnapura, Steve and I, somebody brought him a chap and said he's a good fellow who reads very excellent in palmistry, and he looked at Steve's palm and said, you are going to get a new post very soon. So I think I mentioned now, he is from Ratnapura, the next one he has to go to Colombo. And TDH Perran and what's the name? TDH Perra was the other cardiac surgeon in Colombo with ATS Paul, both. And so, he talked and it was rubbish who believed in it.
Finished.
1 month, not even a month later, TDH
They are going to have another breakout.
always got knocked by a vehicle. RTA, he had a flying chest and treated by multiple doctors. He got a special
gone, that AI people are gone, or they are still there?
When Steve moves in within a month, 3 months, he comes into Colombo.
You don't have any food? No, not yet. That's all right.
Hmm.
So then what happened? How do you explain that?
Yeah, so
This one is.
I know. So, Benita, I
Hmm.
shudder to think that Trump was predetermined for us in America. And that it was that he had to, it was not a result of stupidity and choice, but it was a result of divine intervention of predetermined planetary movement somewhere which I don't understand. So that's the other side of the coin that you have to answer.
Anyway, you know what I mean.
We'll see you later.
In other words, do all our activism or belief or activity make any impact on our life?
Doesn't. No, you just
I
it
don't believe
passes
that.
along. You just suddenly think, but it doesn't control us. It's just something interesting. You know, it doesn't control. You listen and you don't say no. I don't think none of these control our thoughts. It's just an interesting event, like, you know.
Hard work. Hard work organizing all this.
Okay, anyway.
Very much.
Okay,
I think time to wind up, maybe. I don't know, unless people
Yeah,
want to
we are winding
Now
up.
listen, so can we agree on a meeting? Maruf,
Yeah.
can we agree on a meeting date and time now, or we'll get it started? Anyone has any thought?
What about August?
Huh?
August, July? Now it's July.
Yeah, middle of August?
July, no. July.
July is finished. This is July.
Yeah, August.
I'm talking about August or September.
August.
End of August. End of August.
September, later part of September.
End of
Guys,
August.
yeah.
All
End of
till
August or September. August,
Yes.
you know, people are traveling with the summertime and vacations and all that. September?
September. Okay,
September
so
after not the first week, second week, yeah.
Yeah, okay.
First week, yes, the
All the schools are
Australian
starting.
branch of the Colombo Medical Faculty doctors, they have the COMSA branch. They have invited me, and they want all the books for distribution.
Yeah, good for you. Good for you, Benita.
fantastic.
You know, I just wanted everybody to read it. Is partly medical inside it. So,
Yeah,
you know.
Benita, if I meet someone, I'm going to say I'm Benita's classmate.
Wow.
Yeah.
Not a literary award.
No, it's okay. It's, you know what I mean. It's
and soon one of the Hollywood and Bollywood will come to take the
no. It's like
make the
blind leading
movie
the
out
blind.
of
You
it.
try out and something happens. That's all right. But I was a bit surprised when they said we have the meeting and the dean from and Ishan Soisa, Mehmet Soisa's son, they are coming up as the chief guest, and then rang up and said for me and to give the books for free distribution.
I think it was very interesting when Vanasinghe in his sarong, we were having a fight in college house and Plum, and then he went to near the clock tower. He's waited, and the article came. The vice chancellor, he came and said, "What are you doing here?" So Vanasinghe pulled up his sarong and said, "Monada kiyanne mahatya?" Oh, sorry, driver, go.
I know, those are the good days. We can talk about it another day. The
No, but
Maruf was there, I was there. We all kicked out.
He also did another thing, no?
Huh?
One
Sam
day
also Sam, you also kicked out, right?
Everybody was kicked out. But then
we were on the road.
Nanekara used to say, sound, Kalunana. He said, and say, every time somebody says, all of us sitting, he's talking in English. Bricks, and every time he drops a brick, oh, mage kalkura. So he will drop bricks all the time. The other person is our Giant Pereira. Rub the most and say, any story you tell him, he will take all that in. Yes, and he will remember. Then every car that goes, he said that one, his sister is here, mother is working here, all sorts of things.
Okay.
Lovely time.
So Lawrence, will you give your thesis on the occult or the mystery or mysterious?
So let's talk about it. Yeah.
He's a magician too.
He can talk about magic.
Is magic extra Does magic
Lawrence.
I've got a number of things I need to work on in
Neeraj.
September. So maybe for December, but not September.
I am speaking because I have to leave now because my
Okay.
wife says it's past my dinner time.
Okay, all right. Thank you,
Okay,
Madan.
nice
Thank you
seeing
very
you,
much.
Ranjit.
Okay,
Take
Ranjit,
care.
Say hello to your
yeah,
wife.
good
Hello
health,
to your
all the
lovely
best.
wife.
Yeah.
Karunian,
No, no.
Yeah.
Karunian, I have
Yeah.
something to announce. I don't know whether you all remember NT in our batch. I mean, he was with Aya, and like Subba, they sort of came down, and eventually they graduated from our batch. He's very ill in Croydon Hospital. He had a fall from the stairs, and his shoulder is fractured. I'm sure the fall could have been due to a brain hemorrhage because he's now confused and they're worried about anesthetizing him. I thought I better tell you. Married to Kiru. I think they are the oldest couple in our batch, though we didn't know. Older
Oh,
than
right.
Marlin Gowda and Jeff De Silva. Do you recall?
What's the name? What's the name?
NT De Silva.
NTD silver.
What is the N stands for what? What's that?
N stands for Nihal.
Nihal
Yeah,
silver.
this is what.
He's a royalist and married Kiru. She's a Tamil lady. They have a
Maru,
long.
his friend.
Maru, can you put the pictures of all our batchmates which you
I
have?
got.
Can you put it on the Slimo one?
When they were young. I
No,
want,
We
that's
can
why I
remember
want
these
to
names.
build
I
up
can't
the,
remember any.
You have to put a parallel one, the young and the old, young and the old.
But he's
now
in,
we'll get the old one.
he said in the Croydon Hospital.
Wherever possible.
I look like a wild guy in 1960, 50.
Okay. Saro, you are
I will leave
muted.
it also.
Saro,
I'm
you are
trying to get
muted.
up. No, I was going to say, Edwin was going to say something about something he remembered while he was at Blum, and somehow we.
Yeah.
No, it's about Vanasinga.
Manasinga, yeah.
Yeah, he was in charge, MO in charge of one of these remote hospitals,
I
and the
just
SHS went on inspection. He was fast asleep at home. So the message went and he came, and when the SHS asked for the diary, he said, I am having diarrhea, you are asking for diary.
oh, it's interesting.
He was quite a character, I remember.
At least one of the meetings, let's remember some of our colleagues who have passed away.
Yeah.
At least, couple of things to remember without.
Let's build
Okay.
up the list. That's why I said I build up the list and as much as possible.
Yeah.
And
So, Manmeet,
pictures.
Lawrence, if you want to give a talk in December, when we meet in September, do you want to talk about the same subject of the magical and the mystical and the occult, or do you want to talk something else, or can we have 2 sessions on that?
I think Lawrence said November,
he
Karunian,
talked
and
about memory, remember? There are lots of pending things.
No, Lawrence, because I'm interested in Benita's experience and how generalized you can have it. I can't hear you, Lawrence.
No, let them
I can
start
talk
that
about
9 minutes.
placebo effects
Something and something else we can talk. That's a
and
general topic.
self-confirming hypotheses. Yes, I can talk about the psychology of how we believe in these things. As a practitioner and as a, yes, and as a
psychology of
phenomenon.
belief is very interesting. But then why don't we do that in the next meeting?
I've got some papers to submit. I have to write. I'm busy writing things up at the moment.
so November would be good.
Yeah.
November is okay.
Okay.
Is that what
All
you
right.
said? Yeah.
Okay.
We leave it for November.
November should be fine. Yeah.
Psychology of belief.
September we'll
Psychology of belief.
review our batchmates.
Palm reading and Ola reading.
Put a picture each one of them and see who is this. Guess who is this. Guess who is this.
It is not so much psychology of belief, psychology in belief of something very specific. Because we all believe, we can't live without believing.
And ChatGPT surprisingly does recognize all the readings and has a piece on it, but I won't tell you, it'll go on for
No, I'm
fairly
attending a
long.
meeting on AI.
Yeah,
The whole
okay.
meeting conference today.
I have three AIs in addition to OE. One is Microsoft, and the other one is Google. But ChatGPT, I think the one I use most. But I use the other one. The Google is good to write.
Genie, what's her name? Genie. We were talking about it today.
Yeah, Genie, yeah.
Genie and ChatGPT, and they gave about three
is really
AI
amazing.
tools.
If you don't know Notebook NL, you're missing out.
One man said he will give me a AI that will generate video.
Oh
yeah. They all do.
I don't know.
I'm going to use that for our meeting.
Yeah,
Maruf. Genie does
the
that.
article I wrote on the South Asian heart disease, which I sent to some of my friends, I really wrote for my old school journal.
Yeah, that's
that
a good one. That's a very good one, yeah.
Now, that article, one of the guys who saw it, who works at Google, he gave it into the Google AI, and within 1 minute, it produced a 9 minutes
video
of it's a chat. It's a two people chatting. Fantastic! It had all the essential elements.
Just had a show of the video how it works. A gorilla comes and says, "Hey, what are you all doing?"
So my question is: I'll put it up on the Slimo.
I think you put it up on Slimo.
Yeah, I may have done that. Yeah, it took the article, which is about 10, 12, 13, 14 pages live, and took a long time for me to write.
Guy now because he said to come to him because I want to create.
It's AI got into a podcast.
Notebook. You can do that yourself on Notebook NL.
I know. I haven't used Notebook as much, but now for when I want to dictate something, I just talk into it and it types all. I got. It's fantastic.
Okay, let's do that.
All right. Wonderful. All right, folks.
Thank you.
Maru, thank you. Thank you.
Past midnight tomorrow,
Sorry for the
Thank
delay,
you.
but we have done a 2 hour 14 minutes meeting.
Yeah, Maru, put a early notice, and we'll have Lawrence talking and Benita talking.
Yeah, okay. Lawrence is hiding behind the.
Huh?
Lawrence is in his farm.
And Saro, did you send me your address?
The summer.
Bilroy and Saro, will you send?
I will send it now.
Text it to me.
Ilani is going to sleep.
Saro, you texted it to me?
I will send it to you on WhatsApp. Not yet.
Okay, all right.
I'll
Thank
do
you.
that. And Benita, thank you so much for the book.
Thank you for coming.
No, that's all right. Let me
Why
have a
it's not
review.
doing the way that
That's
it
more
is.
important. Read and let me know.
Yeah. I do like 2 book clubs. So it might be a chance for me to recommend this one to a book club as well.
Going to that.
Good.
Comes up only with that. No, they have serious things.
My only disappointment with your book,
One of
Benita,
my friend's daughter is going to be a director.
love affairs in Jaffna and all you haven't put.
Maru, can you repeat that? I missed it.
One of my friend's daughters, he's an orthopedic surgeon. His daughter is going to produce movies. And I told her, please include me in one of those movies. She said she will. And I will.
Ask Salima whether that's allowed. That's all right.
and she said, yes, uncle, definitely I will make one movie. I said, I'll make a movie of Slimo.
Is that movies in UK, USA, or Sri Lanka?
No.
Anyway.
In India?
Hollywood.
In Hollywood. Okay.
Hollywood, not Hollywood.
Bollywood.
Bollywood is Hindi and Bollywood is Tamil.
Okay.
What do you call the Tamil?
Hollywood.
Bollywood.
Because it is Hollywood, Bollywood, Hollywood. He studied in America. He studied, and that guy, he was earning good money because he's doing each of his surgery is
must go
30,000 riyals. That's about 5,000, 6,000 pounds.
Okay.
Okay, can we leave now? Can I leave now, please?
Thank you,
Okay.
folks.
Bye
Thank
bye.
you, everyone.
It's past
you.
12:30, Mass. Yeah.
Yeah,
Thank
it's
you.
about
Thanks.
2 hours
You.
and 14 minutes. Oh, now
Yeah,
17.
yeah.
Okay.
It's
And
nice
thank you
meeting
again,
Maru.
Thank
Gloria.
you.
Thanks,
Thank you to
Maru.
Gloria. Thank you to
Thanks,
Gloria.
Lord. Thanks,
Thank
Master.
you.
Go and have
Thanks
my
for
lunch.
coming.
They're
Thank you,
waiting.
Saro.
Yeah.
Oh,
Okay.
Vale. Yeah, I
Thank
thought
you.
I'll let you know.
Yeah.
Ranjit
Yeah.
went to sleep.
Yeah, I know.
Rima has gone to eat.
Okay, all
I
right.
think
Okay.
Danny is falling asleep.
It's nearly 1 o'clock in the morning now.
I know.
Okay.
Hey, Benita, why doesn't
Thank-
Vikramachandran come? Vikramachandran.
I called
Pardon?
him. He didn't answer.
No, I don't think because of the midnight, no. You see, what happens is at that age, when you lose sleep, next 2 to 3 days you don't sleep. So that's one of the reasons I don't want to come, because it's midnight. For him, it's 12 o'clock and he goes out to bed at 2 o'clock, 2 a.m. And he is not in good health. I think that is one of the reasons he is not coming up.
Oh, he's
What
not-
about Raja, Banda? One Banda,
Raja,
he
I
also
sent
doesn't-
to Raja also this time, and I
Yeah,
didn't
because
call
I
him.
think it's a time.
I think next one we'll try to call each other. You know, I mean,
The people
even
who
if we
suffer
call
are
twice over.
Milroy and I. We get up early, but if you want for the Australians, once we'll do it at 3 o'clock in the morning for us. Now, today it was 5
What I
o'clock.
mean is, for me, it's now because it's winter, it's 10 o'clock. That's not a problem. But New Zealand, no, but now I think, but anyway, I think Vicky is in Brisbane, no, so it should be their time. Maybe it's time. This one, but Banda should be around that. The time difference is the one that's giving that.
What
Okay.
about Narada? What happened? Narada?
That's why Narada is missing now. He was in Colombo. Is he in Colombo?
Narada,
No. I don't think.
I don't know where he is at the moment.
He's
Is
in UK.
Narada, is Narada okay, or is he not well?
That's right. I mean, he was ill. None of us
Narada is
knew.
in UK. Narada,
Yeah, but did you know that he
The-
underwent a major operation?
when?
He just came from Sri Lanka, started having series of headaches. That was ignored to begin with, but what he said was eventually it was a massive hemorrhage and he could have nearly died. So I met him.
I didn't know that. I didn't know that.
He's fine now.
He's here.
He's okay now.
Glory, he's okay?
Yeah. He was here last.
He talks all the time.
Yeah.
No problem.
Definitely.
After the op, he was fine. He started moving normal.
Looking after the grandson.
Yeah,
because you see, he collected 10 books and distributed there, and he may have brought few books for you all.
Yeah, I think I'll talk to him. I didn't know
Okay,
that.
I'll also give him a call.
Yeah.
Okay, folks.
Anyway.
Okay, all the best to you.
Hope it does.
Good night, good night, good night.
Yeah.
Night.
Yeah, good night.
Okay.
Morning.
Okay.
Stay
See you,
safe.
Karunya.
Yeah,
Thank
Milroy, I'll
you.
send a book to you, Majan.
Yeah,
I don't know when I'll find time to come there. Huh?
Yeah.
Yeah.
Thank you. Thanks.
And if you
Thank
send
you. See you, Benita.
Benita,
See
to whom
you.
else should I give? Saro,
You
Milroy?
decide. You decide about if London, the UK fellows, if they want, I can send some.
Okay,
I
all
want
right.
one. I don't know.
Who you like, give.
Okay, all right. Okay, take care.
No
Take care.
problem. Okay.
Okay.
Thanks
Thank
very
you.
much.
Bye.
Thank you. Bye.
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 Bye, Maru.
Bye. Take care.
Bye. Bye,
Take care.
Karunya. Thanks, Saro. Glory, thanks for your
Everybody has
blessings.
gone. Only Milroy, you and me. Salima, of course, is not there on the chair.
Oh, yeah, there's, yeah.
He left the chair.
Yeah. Okay, man. See you. Have a
Bye.
good day. Yeah, good.
Bye.
Bye.